I will talk on patient satisfaction after total knee arthroplasty. Who is satisfied, who is not satisfied after knee replacement? Patient satisfaction is an important outcome measure after total knee arthroplasty. However, despite substantial technique and technological advances in primary total knee arthroplasty, numerous studies suggest that only 80 to 89% of patients are satisfied with the results. 1 in 5 patients are not happy with their outcome at 1 year. The strongest predictor of patient dissatisfaction was unmet expectations. We should not give too much of guarantee at the first consultation. The strongest predictors of patient dissatisfaction after primary TCAR were not met, expectations not met, pre-operative pain and rest. Think twice before operating. If patient complains pre-operative pain at rest. Post-operative complications requiring hospital readmission. If patient requires readmission for any other related to orthopedic problem or related to wound complications, then patient will be unhappy. Characterizing patient preferences. Participants placed the highest value on surgeon factors, including level of experience, satisfaction rating, and complication rates. Providers could offer a high touch bundle. Such a model would include, in addition to being seen by a surgeon, consistent contact from the surgeon and care team, the ability to see the surgeon at the post-operative appointments, giving enough time, and if possible, therapy appointments within the health system in which surgical procedure was performed. Better to do physiotherapy and follow in the same center. That gives a more satisfaction to the patient. Patient reported and clinician assessed outcomes following total knee arthroplasty. Range of knee motion may reasonably self-assessed by comparison with the photographs. Long-term follow-up of patients after total knee arthroplasty may be possible with the use of patient-reported measures, elevating the burden of clinical visits yet maintaining contact. Maintaining contact with the patient in the post-operative period is very important. You can follow through video consultation and you can measure the patient progress through the video consultation. The effect of psychopathology. The psychopathology may impact patient perceived outcomes of total knee replacement. The effects of psychopathology and patient perceived outcomes in indigenous patients was published in JBJ's 2012. The authors found the 35% prevalence of psychopathology in the population they studied, and psychopathology was associated with worse knee society scores 1 year post-operatively. Nevertheless, they found that in indigent patients with psychopathology still benefited with the same total rate of improvement in function following a TKA as indigent patients without psychopathology. Post-operative pain management and its effect on patient satisfaction. Post-operative pain management is one of the most important satisfaction-related parameters for patients undergoing total knee arthroplasty. The study was published in JBJ's 2018. A randomized 100 patients who received analgesic drugs through an epidural catheter for 48 hours into two groups. Half received 40 mg of triamcinolone plus 5 ml of 1% lidocaine and half received 6 ml of lidocaine alone. They found that patients receiving corticosteroids had less pain during motion for 7 weeks and better knee function at 6 weeks post-operatively compared with those who received lidocaine alone. However, there were no differences between the treatment groups in pain at rest or range of motion during 3-month follow-up. Coming to the conclusion, for multiple reasons, understanding the parameters that impact patient satisfaction after TK is important, and further research is clearly needed to lower the rates of patient dissatisfaction. Be realistic, tell the truth to the patient, prepare patient mentally. Post-operative pain management is important in the long run for patient satisfaction. Follow up the patient by the same surgeon in the same center. Do post-operative physio in the same center if possible. Clinician must realize that patient-reported assessment is the best way to determine satisfaction.